Let me have this one. I'll manage it. The green cool. What's today's date? Hello. Good morning, ladies and gentlemen. How are we doing today? I was thinking I gave you the notes last week. We have some new faces in the class. Cool? What's your name? Ibrahim. From where? From I see that Kakachi from Hong Kong. Yes, if you said Hong Kong. What about you? Husna. Husna who? Muhammad Suleiman. You are welcome to Health Information Management Department. This is what we normally do. If we have a new face in the class, the person will introduce himself. Though, as time goes on, you get to know your lecturers better. I want to believe this is the second time I'm entering your class, isn't it? The second time. The title of the course title is Communication in Health Information Management. Some of us will be thinking, why do we have to study this course? Why should we be taught communication in HIM? It's very important because the health information management professionals or practitioners are the first contact in the hospital. They are the first individuals you meet or you see before you see a doctor, before you can see a nurse, before you can see any other healthcare professional or provider. Being the first contact, it means, you know this adage that says first impression matters. How many of you have heard that before? First impression. Idan mutum ya haɗu da kai for the first time, halayyar da ka nuna masa, it will be registered in his mind for life. If you portray a bad attitude towards him for the first time he meets you, even after 5 years, if he sees you again, that bad attitude that you portrayed, that you displayed. So everything you are going to do, he will read you based on what? The bad attitude you portrayed to him. The same thing happens with the opposite. If you are meeting someone for the first time and you portrayed a positive and a good manners or attitude, that will be registered in his mind for life, except if something happens. Anytime he sees you, he knows that he is meeting somebody with a positive and a good what? Character. Kungani? Shi ake nufi da first impression what matters. So if a patient comes to the hospital, what brings a patient to the hospital? For healthcare services and delivery, isn't it? No patient goes to the hospital because he wants to enjoy the environment. Have you been to the hospital before? What took you there? For healthcare service. Have you been to the hospital before? What took you there? For healthcare. You went to get healthcare service, isn't it? Have you ever seen somebody that just walked into the hospital and when you ask him, what are you doing here? You say, "Kawai na zo yawon bude ido." Ba yawon bude ido a asibiti. Say then you go there to visit the sick, isn't it? And that is also good as an individual. So now you can imagine a patient who just came in for the first time, right? Some weeks back. He's coming for the first time. And you that is supposed to be the first person he meets, the health information practitioner. Sai ka dinga shan kunu, kana wani jan aji. You want to even ask him what is his name. You are asking him with a tightened face. Babu Para'a. What do you expect? Dala, what do you expect? The patient's psychology will be affected. He is meeting you for the first time and you are frowning your face like one small iblis. Right? Sometimes that leads to patient to what? To be having phobia. They will not be able to communicate effectively. Saboda me, you did not give them that avenue to be relaxed and be free with you. And whatever is going to happen to them in that hospital for that day, their mind will be negative towards it. Because what impression you had given to them will make them believe that kowa ma a asibitin nan haka yake. Isn't it? Just because of one officer, one person, you have changed the mindset of an individual who came there to receive what? Healthcare service. If he goes to the nursing station for triage or where he wants to pay for the registration, his mind will be saying, "I kowa ma yanda wancan yayi min haka wannan ma zai yi." So he will not feel too comfortable if he also has that kind of attitude. Sai ko gan shi ma yana shan kunu, yana jan aji. Isn't it? If he finished with the billing unit, he went back to the officer wanda ya fara matsalar. Then my life continues. Go. After that, what happens? After that, what happens? He will be sent to the triage unit. Akwai inda ake kira triage, inda ake ɗaukan mai vital signs, your pulse, your temperature, your BP, and the rest. And because he has registered a bad experience with you, the health information practitioner or professional, he is not going to be friendly at all in that unit. You see, just by your attitude, look at what has changed in the life of the patient. The same thing will happen if he goes to the doctor's office. His psychology will be telling him that everybody in this hospital is like the first person, and which is not. Do we understand? Now you can imagine you have a scenario where the opposite is the case. Instead of having a record officer who frowns, who used to shakunu, as if the world is coming to an end. Now you have an officer who smiles, who jokes, who is approachable and simple. On getting to his office, irrespective of who you are, your status, your condition, he looks at you at the face and give you a smile and say, "Assalamu alaikum, good morning. Hajiya barka da zuwa. Yallaɓai barka da zuwa." Now, I want you to imagine that it was you. Hajiya barka da zuwa. Yallaɓai barka da zuwa and Hajiya barka da zuwa. Yallaɓai barka da zuwa. Which one is better? Tsakani da Allah. Which one is better? Okay, let me not even go far. You are a new student. You came to my office. An kawo ku to come and be registered. Kuna shigowa sai na ɓata rai. Who are you? I just frowned my face. Yes, who are you? What's your name? Now? Khadija who? Sagir. Khadija Sagir was brought to my office and I just frowned my face. Who are you? She said, Khadija Sagir. I said, yes, what can I do for you? I'm your student, sir. What do you want? I want to open file. Go and come back later. What do you think? How do you think Khadija will feel? Or the class rep, the first time the class rep walked into my office, I remembered our conversation with him. I was very busy, but I think I gave him time, right? You can imagine he came into my office, I'm a new student, and I said, hey, come by later, I'm busy. What do you think the impression will be on the class rep's mind? Kai wannan HOD din fa mugu ne fa. Yadda yake wani shan kunu sai ka ce kamar shine kaza kaza ka anya zamu wani lafiya da ba Allah nan ka gaskiya ba na je na canza department. It happens, right? Now in the hospital, when you have a positive minded individual, somebody, a health information practitioner who is at that post with the positive attitude, it is this type of officers you will see. If a patient wants to come back for follow-up, he will be requesting that Allah inawani, please, where is so and so? I want to see so and so. Patient requesting to see a doctor is not because the doctor knows how to walk, but because the doctor knows how to treat, how to relate with them. It's not the type of doctor that you just look at you and say, no. Or he's not the type of doctor that you are talking to him, he's operating his phone. He's not the type of doctor that you are talking to him, he's looking at you right in the eyes and he's not smiling. But he's the kind of doctor that when you talk, he listens and you see the emotional expression coming from him. Indirectly, he is telling you, he is communicating to you that I am with you. I understand your situation. Take it easy. Everything is going to be okay. Do we understand? Compared to the other person who frowns. You will not be even able to talk. You will not be able to communicate freely. Do you get it? Now, health information management professionals are the ones that needed a good manners first, because they are the first contact and also the last. There are certain adages you hear that we are the gates of the hospital. No patient comes into the hospital without meeting the HIM professionals. You meet us first and you see us last. Allah ne ba mu wannan. Do we understand? You meet us first and you meet us last. You cannot go without meeting us last. Do we get it? Now, what we are going to be looking at is not the abstract form of communication, but the practical form of communication that you and I need to understand, develop skills on, and put it into practice. Because after your second semester, you will all be going for what? Practicals. It is very important that you take note. Your attitude, your manners matters a lot. You are dealing with human lives, even if you are not the one treating them, but you can also reduce their pain psychologically. Do we understand? Communication is a vital component of health information management practices. Very important. Effective communication ensures the accurate, timely, and secure exchange of health information among healthcare providers, patients, and other stakeholders. Maybe in your second semester, there are certain topics that you have to do, undergo, that talks about the nature of the hospital. I think they should teach you in health information management course. What are those things, the right of a patient? What are those things a patient should have? The theory into practice, or some of those legal implications of a patient's health information. Mun gane? Dole ka sanar da shi cewa za a maka kaza, za a maka tiyata, za a maka aiki, za a yi maka kaza, zan baka magani iri kaza, ka sha kwana kaza. Isn't it? Why are you telling the patient? Because he has the right to know. Hmm? He has the right to know and he should accept the treatment that you are recommending. That also aids effective what? Communication. Unlike here, a patient was rushed in the hospital but not unconscious. Maybe he has some hatsari ne that affected his hands. And there is a need to ampute. Za a yanke hannun. Misali. Do you think it's legal or legal for the healthcare providers or the hospital or the doctors or physicians, whoever is on duty, to just take the patient into the theater and go and cut off his arm? Me ya kamata a yi? Akwai abin da ake kira consent. Sai ka nemi izinin patient ɗin. You will have to explain to him the procedure. Za mu yi maka kaza. This is what we are going to do. And this is the certain percentage of wane ne da sauransu. You explain to him. Let him understand the full nature of what is to be done on him. Then it is up to him. A yanke. Kar a yanke. A kyale ni. I came to this world with my arm. I want to go back with my arm. Kusa akwai mutane haka. Ko ba gaskiya bane ba? So these are some of the things that we should all understand. Now, let me see if we have something like that here. We don't. I want to show you something very important. Now, look at this. No, let me cover it so that Masushi will not hold me responsible. This is a sample of a patient case note or a file. Kuna gani? What is written here? Kina da matsalan gani ne? Kina sai ka ce tsohuwa. She's doing like this as if she's a 50, 60 old and somebody. What is written here? Okay. What is written here? What is written here? No. Okay, you're having eye issue too? I better go and get a glass. Not to be handled by patient or patient relative. Go. All right. Class, what is written here? Not to be handled by patient or now, what is this message trying to tell you? Or trying to tell us, you the health information officer? Kun san akwai asibitocin da if you go, they will give patients this. Isn't it? This is to tell, it's a form of communication, isn't it? The hospital is communicating to the general public, even you, the officer, you, the students of HIM, first, and any other person, and any patient who has sense. If an officer gives you a file, kakarba, kai guri kaza, you go there and read. Not to be handled by, they said not to be handled by patients or their relatives. But if you try that in our hospital, but practice, it's not, a patient is not supposed to hold this. This is a simple communication, isn't it? But a lot of us will go against it. Right? Now, it is very important that you note this. A patient information is very, very important. It's vital for you to know that protecting it is your primary responsibility. Safeguarding the information is your primary responsibility. Archiving the information or storing the information is your what? Primary responsibility. Securing it, making it private and confidential is your primary responsibility. Making the information readily available to healthcare professionals or providers or practitioners that need it is your primary responsibility. When a doctor requests for a record and he wants to use it to treat or to, examine a patient, your responsibility is to go and retrieve the record and bring it to who? To the doctor. And at the same time, if the doctor is done, it is your responsibility to carry the records, the file of the patient, and return it back after passing through all necessary form of what? Documentation. You return it back to where you brought it. In doing this or in doing that, you are protecting the record of who? Of an individual, so that gobe idan ya dawo, another doctor can also what? Examine him. Do you understand? All right. Just like we said, communication is a vital component of health information management. Effective communication ensures the accurate, timely, and secure exchange of information among healthcare providers, patients, and other stakeholders. In health information management, remember I gave you an assignment in the previous class to define communication in 10 different ways, right? So let's use that knowledge to understand this. In health information management, communication involves, I will advise you to joke. If a lecturer is explaining, try to what? To joke. There are certain things that you might not see in the notes. During explanation, there are certain points, very important points, that you need to actually capture. Note taking. Learn how to do note taking. Mungani? Good. In health information management, communication involves the following. 1. Interpersonal communication. 2. Technical communication. 3. Written communication. That means you as student of HIM, you will one way or the other engage yourselves in one or all among all of these 3. Interpersonal communication, technical communication, and lastly, written communication. Aikinku, aikinmu bai wuce waɗannan ukun ba. When it comes to what? Communication in terms of our profession. 1. Interpersonal communication. Me yake nufi? Interpersonal. The face-to-face or verbal interaction that you have between yourself and your colleagues. Mungani? Between yourself and your patients. Between yourselves and the outside what? Environment in respect to your practices. Shi ake kira interpersonal communication. Alaƙan ka ya zamanto alaƙa ne mai kyau. Mutual understanding. Mutual respect. You are a health information management practitioner or professional. You should respect a pharmacist. You should respect a medical doctor. You should respect a nurse. You should respect students of HIM that will be posted to your unit on practicals. Isn't it? Because respect is reciprocal. Go. You give respect to get respect. If you don't give respect, you will see any. People might only respect you because of your position, maybe don't couldn't amma naturally babu respect. Ran da ka talauce zaka gane baka da hankali. Mun gane ko? Ran da ka sauka daga wannan kujerar zaka gane baka da hankali. Ashe ka dade kana wulakanci. Do you understand? So that is interpersonal what communication, and the families, okay, your family, the family of the patient, and any other individual. Maintaining that good rapport is important. day in, day out. In kuka je asibiti, this is what health information practitioners involve themselves in. You meet new people every day. Different faces. The good, the bad, the ugly. Duk za su zo. Amma you should maintain a good interpersonal communication skill. It will make you to be what? Superior over any other person. Let me give you a little story. When I was serving in General Hospital Suleja, sometimes in not serving, sorry, when I was doing my IT in 2012 or 13, I could remember in I think pediatric unit or so, POPD. There was a lady. She was, I think, an Igbo woman. I can't actually remember the name. I was engaged in patient registration. You know, during patient registration, you ask the patient his information, right? His data. What is your name? What is your date of birth? Your next of kin? Your phone number? Your this? Your tribe? You understand? You ask all these questions. So I was asking her what is her name, and you know, sometimes there are certain tribes in this country that if they don't spell the name, you will not be able to spell it because it is not your area of specialization. So she told me her name. Nick Mobawang Allah, I just wrote what I could deduce to be the spelling. The next thing the medical is I just had a knock on the head. On the head though. I was married though. She just knocked me. Bam. What you know, sometimes there are certain things that you don't need to react. You will only be surprised. I was writing, and when that knock came down, I stopped writing and I was thinking for some moments. Like, Mike Parwani, is this woman okay? Like, I was surprised. Is she okay? Are you sure she's not mentally affected? Say na daga kai na sama. And I said, Madam, did you know you knocked? You just knocked me. She said, oh, sorry. Please, I'm so sorry. I am used to it. This is how I used to do to my staff in the working place. I said, eh? Your staff? I'm, isn't it? Gata fa ita ta min laifi ko? Isn't it? Ita ta min laifi. Amma if we go to the court, wa za a ba rashin gaskiya? Ni za a ba. Saboda tambaya ta za a yi, wa ya ce ma ka je ka karanta HIM? Ai akwai code of conduct. Kuna da shi mun baku? Every profession has what is known as code of conduct. Principles that you are supposed to what? Upheld. Principles that should guide your actions. Kuma ɗaya daga ciki shine you should not. Kuma ɗaya daga ciki shine you should not. Kuma ɗaya daga ciki shine you should not. That makes a health professional to insult a patient. Babu wani dalili whatsoever. Babu. If you have a problem with, there is no harm if you protect yourself. Somebody came, misali, a patient, that might you can have sort. Maybe he's mentally affected. Says, you know, you cannot sit down and say, I can buy online. No. You can't do that online. You need to protect yourself. You understand? But in a normal scenario, you are not supposed to be reactive. You should be patient. You can stand up, pause the work. Kana da damar da zaka iya hana ta registration din a lokacin. It's enough punishment instead of making it what? Physical. Do you understand? This is one that happened. The other one happened during when I was serving, when I was doing my NYSC in same hospital, General Hospital in 2017. In 2017, NHIS clinic. You know, on a fateful morning, you know, every time I used to come to the hospital with a positive vibe. But I wouldn't dare that mean. Because I was enjoying my work. I loved the work. I came very early. When I came in, I met one of our colleague, Allah Jikanta,